One of the biggest mistakes in the pandemic was the lack of honesty and integrity with regards to what was understood and what wasn't understood in the pandemic. It's because of that failure why so many people have lost trust in science, vaccines, and health in general. This cannot be fixed until there is openness, acknowledgement of the mistakes, and a determination to try and make things right. Very few people have tried to do that. Instead, because of ego and other reasons, they have opted to remain silent or to continue to prolong a narrative that clearly makes no sense to the public. Now, one of the people, Dr. Deborah Birx, who was part of the Trump coronavirus White House task force, has come out just recently with Piers Morgan and said something that makes perfect sense now, and it's what we were saying before, but we were censored for saying it. I'm going to play that shortly. Just before that, though, I want to highlight to you that as we continue to dissect the pandemic, we are looking at every aspect of it, looking for unusual patterns. And one of them is what I call the COVID neurological storm, India's most dangerous outbreak of disease X. This is an important topic and one I've been following for some weeks now. Essentially, what we have is that we have a situation where India are facing one of the most unusual surges of Guillain-Barré syndrome. The question is why? It's in the region of Pune, and I've looked carefully at it. And what I'll be doing in this presentation, if you look in the description, you can join me for the Eventbrite because I'll be trying to break down the science as to why I think it's happening based on the pattern of COVID connections. Very important topic, and it's likely to present the way how many other diseases will present over the next few years to come. The latest update on it, 37-year-old who was a taxi driver, he died. He was the seventh death. They have had over 200 cases of Guillain-Barré syndrome, which is unprecedented. They have linked it to Campylobacter, but in truth, it's going to be far more complicated than that. And so therefore, this is why I'd encourage you to join me in terms of looking at the science around that. But let's get back to what Dr. Birx had said on this Piers Morgan discussion. Important for us to reflect on when we realize the mistakes that were made. Let's hear her make her comments, and you can then reflect on it.
And what we've done wrong in public health is we didn't explain that COVID vaccines were nothing like the childhood vaccines, and that the childhood vaccines, like many of the diseases, you get it once, you don't get it again. And this is getting the children to have that disease without getting the deadly consequences. That is not what the COVID vaccine was designed to do. It wasn't designed to prevent against infection. And if you look at the vaccine hesitancy rates, they've doubled since COVID. So we have to start addressing these things. We can't just ignore them.
And Deborah, let me ask you, Deborah, I mean, given that you were the face of COVID from the Trump presidency at the time, do you share this doctor who I was with, do you share the concerns about the longer term negative impact of some of the COVID vaccines?
The messenger RNA vaccine should have been rolled out for the people that were at risk for severe disease, because that's what the vaccine was developed for. But when we say that we're following the science and the data, we need to follow the science and the data. And the science and the data said people primarily over 65 or people with significant comorbidities were at risk for severe disease. Those are the individuals that should have been immunized first. And we should have put our science behind our immunization schedule and protected those most at risk. It went into young people in hospitals before it went into our elderly in nursing homes. That is not following the science and the data. So I am all for following the science and the data, but it shouldn't just be a statement. It should be a reality.
That's really important because finally, people are talking what the truth is. It was blatantly obvious for anyone who was looking at the data that you needed to target your high risk group, high risk who had not previously been infected. Those are two of the mistakes. One, they didn't just primarily target the high risk group, they also told people who already had the infection that they also needed to be vaccinated. I cannot explain from a scientific point of view why they did that, other than the logistics, maybe, because there was no science behind it. The implications now are very serious because no longer do the public trust what they're being told from the scientific community. They no longer trust any vaccines because they presume that all vaccines work in the same way as a COVID vaccine. And we have destroyed the integrity of something that had been very important for health and well being for decades, all because there is a determination by some, from a political and a financial sense, to try and push through a technology that the world doesn't seem to be ready for, that isn't yet up to the standards that we require to have a vaccine. Now, listen, final point. Just remember that the most important point you have to think about, a lot of people keep on saying that side effects occur with everything, with every medication, with every surgery, and so on. There's a very important difference with a vaccine. A vaccine is given to a healthy person who doesn't have a disease in the hope that it prevents them from getting the disease in the future. So it's different from a medication where someone is already sick and you have to give them something to get them better, or surgery where there's already a problem and you have to do something to try and get them better. With a vaccine, there is nothing wrong with the person. You are, however, trying to protect them for the future. If you make them sick with the thing you are supposed to protect them with, it would be no surprise that they would never trust what you have said and never do it again. We have to do better and undo the harm that has been done to the integrity of medicine and science. Have a good evening.